Okay, so this video is going to be more about the examination portion of TMD. So it's geared more towards the physical therapist, but just so everybody kind of knows what we're doing, we'll go over everything. So first of all, doing your subjective or taking your history of these patients, you want to ask about any trauma, if they've had any trauma to their face or to their jaw, if they've had any type of oral surgery recently, if they are a gum chewer, or if they always eat mints a lot and are biting down on things like that a lot throughout the day. You want to ask about if they have joint sounds, so if they have the popping or the clicking noise. And then you want to also do some observation. So you want to look at the symmetry of their face, you want to look at the position of their head and their neck, look at their resting mouth position, that sort of thing. I would definitely probably take cervical range of motion, because if you're getting somebody that's got a lot of the forward head rounded posture, they're going to have a lot of cervical limitations as well that you can address. So take cervical range of motion. Then you also want to take range of motion of the TMJ. So you're going to need one of these little things, which you should have over there in the clinic. And basically the way it works is you've got a little kind of notch here in the end of it, and that goes between the front two bottom teeth. So I'm going to demonstrate here with Ashley. So you're just going to have them open their mouth a little bit, and you're going to put that right there between the bottom two teeth, and then you just tell them open your mouth as much as you can, and you kind of roll it up so that it's between the top two teeth, and then you can read the number on it. So for her, she's at 47. Now, normal opening range of motion is going to be between 35 and 50 millimeters, so she falls right within normal for that. Another quick way to do it, if you don't have this normal opening, they should be able to fit between 2 to 3 knuckles in their mouth. So that's for opening. Okay. Then you're going to do 2 other measurements. One is going to be lateral movement, so moving their jaw left and right. To take that measurement, you are going to use this set of numbers along the straight edge of this. There's a little arrow right in the middle, and that arrow, again, you're going to line up with the space between the bottom two teeth. So you'll line that up right in front of the person between their bottom two teeth with their mouth open, and then you just tell them move your jaw to the left as much as you can, and you kind of keep it in line with the top two teeth and see how many that goes over, and then you tell them to go the other direction. Good. Okay, so then you just measure that. Lateral movement, left and right, normal range of motion is going to be between 10 and 15 millimeters. Now, the last one is going to be what's called protrusion, or jutting the jaw out to the front. So for this one, you're going to have to be on the side of the patient, and you're going to line this up again with the straight edge with their teeth. So you're going to line that up just like that, and then you're going to tell them to jut their jaw out to the front as much as you can, and you see how far the teeth can go out to the front. Perfect. And then relax and go back. So for that one, you're looking for 4 to 6 millimeters of movement. Of course, while you're doing this, you want to see if there is any popping noises, if there's any abnormal like shaking or movement of the jaw while they're doing each of these. So that's the range of motion measurements. Okay. Then the next set of testing that you're going to do are special tests. So once you get into these, you're going to be kind of touching their mouth and their jaw a little bit more. So you definitely want to take gloves and use that. I would also recommend using gloves that aren't powdered, because that's kind of gross to put powdered gloves in someone's mouth. So for these, the first one is going to be what's called a bite test. So you're going to need a couple of 2 to 3 tongue depressors, and what you're going to do is kind of stack them up, and you're going to put these along one side so that they can bite down on that. And this test is going to tell you whether it's a muscular involvement or whether, wave your arm, or whether it's a joint problem. So you're just going to kind of put these along the side of their mouth, right along the teeth, okay, right like that, and then you're going to tell them to bite down. They're going to bite down for about 10 to 15 seconds. Now, if Ashley were to tell me that she has pain on this left side where she's biting down, I would know that that's a muscular problem. Same side means muscle. If she were to tell me that she had pain over here on the right side, that would indicate to me that she's got a joint problem. Okay? All right, relax. And you want to do that on both sides with them. Okay? Now, there's two other special tests that can be done. One is going to be a forced loading of the joint. So basically that means that you are compressing the joint. The other one is going to be a distraction of the joint, meaning you're kind of pulling it down. So the compression of it, you're basically going to take your hands, put it in their mouth, and you're going to press up, okay? So open your mouth for me, okay? And then you're just going to forcefully push up like that, okay? So that's going to be the compression, and then the distraction is just going to be the opposite. Again, you're going to use your thumbs, and you're just going to push down that way, okay? It may not be super comfortable for them, especially if they've got TMJ pain already. But those are going to be the special tests. So with the forced loading, you're compressing the disc again, and then with the distraction, you're relaxing it. So with the distraction, they should kind of have a little bit of a relief of the pain probably. So that's everything as far as that goes with the evaluation. The other thing that I usually do is just going to be palpation of the muscles. You want to palpate the temporalis muscle, palpate the masseter, which you can also palpate from the inside, just slipping your finger all the way back against the top teeth and then pressing laterally. You'll be right on the masseter muscle. You can also press on the pterygoids by doing the same thing. You're going to slip your finger all the way in and press down because they're going to be underneath the jawline here. Usually when you're doing that, if it's a muscular involvement, when you press on those muscles, you'll really notice how much hypertonicity is there. And they'll usually be pretty sensitive with you pressing on it. So that's everything with the evaluation. I've also kind of made a little handout for some patients that have got some information that at the end of the evaluation that you can give to them. I'll send this over to you guys. It's got a picture of the joint, and it just kind of goes through some of the information that I've told you guys about, and it's got some tips for them at the bottom. So that's everything with that.